Hi there. My name is Sevag Demirjian. This presentation is part of an educational series about kidney medicine and extracorporeal support. Enjoy. Hi there. Today I will talk about cups, the in-house produced ultrapure solution for continuous dialysis. The Cleveland Clinic method for CRT solution production has been continuously used since its inception in the early 1990s, although it has undergone several modifications since, which have been reported in detail in several publications. In a typical dialysis setup, which is connected to a water treatment source, you'll see a counter-current flow of dialysate against the blood in the filter. Naturally, in cups production mode, we will not have the blood circuit. As usual, dialysate solution is produced by three-stream proportioning system. However, at this point, the dialysate will cross the membrane to the blood side and gets collected in a bag. Few important modifications need to happen here. The dialysis return arm is clamped. The other arm of the blood line is clamped and placed in a jug. In order to trick the dialysis machine that there is a spent dialysate return, the Hansen end is placed in a jug. And to establish a closed loop, the drain line is also placed in the jug. In recap, dialysis is produced in the machine and crosses the membrane to the blood side and subsequently collected in a bag. We have a recirculation jug which recycles a small amount of fluid in the machine's drain system, which will allow the machine to operate with no interruptions and at full speed. There you have it, a simplified schematic presentation of the Cleveland Clinic Ultrapure solution production method for CRRT. Thank you. Hope you enjoyed the presentation.